Hi, my name is Tiffany Hall. I, Amanda, and Amy will present to you information pertaining to the disorder cellulitis. Objectives. By the end of this presentation, you should be able to define the term cellulitis, identify 2 risk factors for cellulitis, identify 3 key symptoms for cellulitis, identify the prognosis for cellulitis, identify the treatment for cellulitis, identify the impact that cellulitis has on the family, identify 3 nursing diagnoses and associated interventions with cellulitis. The word cellulitis literally translates to infection of the cells. Orbital cellulitis is an infection in the tissue surrounding the eye. The discovery of antibiotics greatly changed the complications from orbital cellulitis. Before antibiotics, 20% of patients with orbital cellulitis were permanently blinded and 17% died from the spreading infection. Here is a photo of orbital cellulitis of the left eye. Cellulitis is a spreading infection that is caused by bacteria. There are 2 bacteria that most commonly cause cellulitis: Streptococcus and Staphylococcus. Here is a photo of cellulitis in a patient's lower extremity. Risk factors for cellulitis consist of dry, cracked, peeling skin to feet, peripheral vascular disease, diabetes, or other circulatory problems, especially with ulcers. Broken skin from injury or trauma. Surgical wounds. Insect and animal bites. Corticosteroid medications. Immunosuppressant medications. to the National Center for Biotechnology information, cellulitis is fairly common. 24.6 out of 1,000 persons are diagnosed with cellulitis. Cellulitis is more common in men than in women. Cellulitis is more common in men aged 45 to 64. 78% of cases are treated in the outpatient setting. The most common site for infection is the lower leg. 39.9% of cases are lower leg. In part 2 of this cellulitis presentation, I will discuss the pathophysiology of cellulitis, common signs and symptoms of cellulitis, how cellulitis is diagnosed, and cellulitis prognosis. Body systems affected. Cellulitis is an infection of the dermis and subcutaneous tissues. It most commonly affects the lower extremities. However, if cellulitis is not treated properly, it can spread throughout the body. Cellulitis is often an extension of an injury to the skin, an open wound on the skin, a furuncle, or carbuncle. Common signs and symptoms of cellulitis consist of redness, warmth, swelling, and pain in the affected area. Other signs and symptoms consist of chills, sweats, fever, and swollen lymph nodes near the affected site. Cellulitis is diagnosed via blood cultures and culture of wound drainage. The prognosis for cellulitis is extremely good due to its great respondence to antibiotic therapy. Treatment is short-term. However, if cellulitis is not treated properly, it can result in tissue necrosis, and it can spread throughout the body, resulting in septicemia. Activities of daily living are not usually affected. However, some individuals may experience difficulty due to discomfort. In the final segment of this presentation, Amanda will present to you ethical issues related to cellulitis, the impact of cellulitis on the patient and their family members, and the appropriate plan of care for persons diagnosed with cellulitis.